that way. Or they can pick up disease indirectly through contaminated water that's in the food chain or through agricultural practices later. All of these need to be included in your planning. Strategy 6. We have to recognize that many of the water-related diseases that are common in water disasters are not generally seen by the medical care providers prior to the disaster. These are unusual diseases. Many medical providers may be very unfamiliar with these diseases and miss them. They're not diseases they may see in their traditional daily practice. I'm giving you an example here. I won't read through them, but these are the diseases that were part of Hurricane Katrina, and these are water-related diseases that I guarantee you most physicians in the United States have never, ever seen a case of. So another thing is to make certain that your medical providers are aware of the possibility of very unusual diseases after a water disaster. Strategy 7, and I know Judith is happy I've placed this slide in. We talked a lot yesterday about microbial pathogens, but it's absolutely also important to be thinking about chemical agents in flooded water and contaminated water. You have to really value the specific challenges that you're going to face around that. So we briefly talked about these unusual waterborne diseases, but it's absolutely frequently overlooked, the chemical contamination aspect of it. You can see from this slide, and this is again from southern United States, they put in a boom, but this is a chemical facility, and this is just full of fractured tanks and all kinds of issues that are going to be in that contaminated water. It's a massive challenge. This is the end result. This is strategy number 8. You have to be thinking about not only microbial pathogens in combination with these chemical pathogens in water. This is an unfortunate resident of New Orleans trying to get to safety and dry land, and she is swimming and walking through for a full day and a half, chemically contaminated, and you can imagine a lot of biological contamination in this water. So when I see this patient, I have two things that I have to worry about, not only the infectious disease, but also the challenge of evaluating her for that chemical exposure. Strategy number 9. It's really important, and we saw this certainly in Haiti, but we also saw it in New Orleans and many other places in the United States. You have a significant surge of patients at medical facilities, a large number of seriously ill patients, all presenting for medical care, all exposed to contaminated water, all at the same time, a huge surge. We've had several examples in the United States where this has been a major problem. So it's extremely important to prepare for a scenario with a large number of patients who are seriously ill after a water disaster or contamination event at the hospital all at the same time. So this photo shows a young girl who was exposed to toxic E. coli in water, who ended up in kidney failure and subsequently died from a waterborne outbreak. Again, reinforcing the idea that young children are really susceptible. I'm almost done. I'm going to move along. 10. Again, this is also an example of what happened in Haiti. You have to remember also, because these are going to be very ill people, and there may be many vulnerable populations who would have deadly consequences from waterborne exposure, they may need emergent and sophisticated care. That includes emergency evacuation. We know from Haiti that specialized care, particularly for children, was not necessarily available in the field. So this concept of how do we get people to sophisticated care during a water disaster is a huge challenge. This is another example of Hurricane Katrina, with a hospitalized patient being helicoptered to sophisticated care. Again, the prioritization of those special populations and thinking about the consequences of very ill people needing very significant care. Strategy 11 and 12, I'm going to quickly go through, but these are equally important. You really must protect your emergency workers and medical workers when they're deployed to water disasters. They are at increased risk for all these water-related diseases that I talked about. Worker protection is frequently overlooked, I believe, when preparing for these water disaster events. These people need to be pre-screened, and they need to be screened once they come home. Again, remember, if they're diabetic or they're in one of these special population groups, you have a responsibility to make certain and educate them. Perhaps they shouldn't be in the field, they should be back at the home institution, because once they leave their home institution, they suffer from the same consequences of the residents in the water disaster area. So again, I always encourage folks to be thinking about providing them special equipment, providing them with training, because I think risk reduction training and making certain that people understand the specific hazards when they go on site to a water contamination event is extremely important. This is an example of doing it right. This is a decontamination team that were scrubbing down all the water disaster workers at the end of their day, literally had a line to bring them down. Frequently, Americans in particular, we're a wonderful volunteer nation, but people don't understand it may take 6 to 9 months to get their vaccination scheduled to make it appropriate and safe for them to go to another country. So immediately getting on a plane and running to Haiti without thinking about those things may not necessarily be helpful, because you may become a problem in the country that you are attempting to aid if you're not thinking about those consequences ahead of time. 13, thinking about short and long-term consequences of water. Judith will probably talk a lot about the fact that it can impact the environment and cause health problems for decades later. 14, the point I made earlier on, you really need to do this from a multidisciplinary team approach. You need healthcare providers, public health folks, law enforcement. One thing I do want to talk about, and we have a reporter here today, you really need to also engage public risk communicators in the media to educate people. And never forget, the private sector, industry, and small businesses can be vital at the local level and certainly at the global level in working through this. And my last slide is really basically the bumper sticker for my presentation. It's really this model of medical planning and response. You really need to be thinking about working together and communicating. That would be the drinking water professionals, government authorities, public health, community leaders, medical emergency response community, all working together. I find in many countries and in many states in the United States, these are groups that generally don't work together. So water brings us all together and really forces this coordinated approach. Got to communicate effectively, coordinate our efforts, and really collaborate, because the end result is for us to protect the patients and the water consumers in the middle here. So that's my brief version. I'm going to turn it over to George and Judith, and I'm anxious to hear your questions at the end of our session.
Thank you, Dr. Meinhardt, for a fabulous presentation. I think that's a nice segue into a quick 2-minute overview of the staff writer of Philadelphia Inquirer, Miss Melissa Dreibin, in terms of giving us maybe a 2-3-minute overview of her experiences in just coming back from Haiti in terms of reporting on the Haiti crisis as well as the water issues there. So, Ms. Dreibin? Driven. Yep. Sorry.
Well, I didn't expect to be here, but I'm really honored to be part of this. I was sent immediately after the earthquake to report in Haiti. I spent a little less than 2 weeks there the first time, and then I returned in mid-March to do follow-up stories, and focusing this time on the problem of water, clean water access for the displaced. Nearly the entire city of Port-au-Prince is living out of tents, or mostly in shelters that are just sheets held up by wooden sticks. I interviewed a mother whose 10-year-old son had been throwing up and had diarrhea and fever, and she finally got someone to take him to a hospital. He spent 10 days on an IV with typhoid, being treated for typhoid. The families that I saw, they prefer to buy water rather than get it from the public sources. I've been told that about 25% of the city had access to clean water through the city system before the earthquake, only 25%. And so a lot of the issues that Dr. Meinhardt was talking about, the disaster existed long before the earthquake. There was never easy access to clean water for many people living in Port-au-Prince and the areas around there. They consider it a luxury. They spend money on buying water from these privately run kiosks. That seems to be the primary source for most people, and the source that they trust. Even people who had access to the city water didn't trust it, even though it had been tested and was being treated by a nonprofit organization with chlorine. So let's see what else I can tell you. Their malnutrition is rampant. Anemia is rampant, and so many of the kids are really vulnerable. But from what I understand, there hasn't been a major increase in waterborne illnesses like cholera or